Let's talk about proton pump inhibitors, also known as PPIs. Proton pump inhibitors are medications like Protonix, Prilosec, Prevacid, and they are most commonly used in treatment of GERD, but can also be used in treatment of esophagitis, inflammation of the stomach lining, eosinophilic esophagitis, and other conditions. I get asked pretty frequently if it is safe to take these medications in the long term. There have been multiple articles that have come out over the past several years that have tried to link proton pump inhibitor use to some very scary things, such as Alzheimer's, increased fracture risk, increased occurrence of C. diff, pneumonia, or COVID-19. Though these things sound extremely scary, one important thing to note is that most of the time, causal relationships cannot be determined, meaning that the patient is taking these medications and they happen to have one of these disorders, but they cannot say that the medication is what caused this concern. That being said, in recent years, there's been a huge concern that proton pump inhibitors are being prescribed when they really shouldn't be. So going forward, most recent research says that if there's not a clear indication for a patient to be on a proton pump inhibitor, then a provider should try to take them off of the proton pump inhibitor. This would include trying to de-escalate therapy, going from twice a day dosing to once a day, or decreasing the dose, or doing a complete stoppage of the medication. There are, however, clear indicators that a patient should not be taken off of a proton pump inhibitor, and those include Barrett's esophagus, which are precancerous changes of the esophagus, LA grade D or C esophagitis. When taking these medications, it's important to visit with a gastroenterologist or your primary care provider to talk about the different risks and benefits of taking these medications and determine if you should be on them long term or if it's time to try tapering those down.